guys, what you're looking at, we have these prominent masseters. This is now the second time we're injecting our patient. And Augustina, if you don't mind disclosing your age, how young are you?
23.
23. This is pretty much now becoming a typical patient in young age, stress clenching, etc. I discovered Augustina's TMJ disorder or excessive clenching when she was at our home with her mother, where I saw prominent masseters. That was about over a year ago, Augustina, is that correct?
Yes.
So we're now on our second dose of treating the masseter and the temporalis muscle. Bite down for me, please. Right now you see my fingers move out. They weren't it's actually worse. They're not as bad as they used to be. So all we're typically doing is finding the belly of the masseter and mapping out where we need to bite down again for me, please, and finding out where we need to inject. We're going to kind of come out with our no-fly zone. What that is basically area we cannot really inject and hurt the patient. There's some vital nerves and arteries that go through it. We do not want this medication to go in there. And it literally is just demarcating some of those areas and figuring out where we're going to best treat it. Tilt your head a little bit towards the other side. Bite down again for me, please. Squeeze. And then we have our temporalis muscle. And it's a pretty large fan-shaped muscle. And much better this time. Medications actually worked in. So all we're doing is marking it and then kind of fanning it. In patients that come in with extreme pain, we do a little bit of dry needling too with the syringe itself. And what happens over a period of time is these muscles, where our goal is to shrink them or weaken them. You're still able to eat, drink, talk, none of that gets affected. And the first time when I injected you, did it hurt?
No.
That is hurt. And these are very, very minor needles that typically don't bother the patient at all. These are for patients who typically use insulin, and that's all we do. The only things we recommend patients not do is work out, excessively rub their face, or get a massage the same day. Any kind of normal activity is fine. The medication takes about 2 weeks to kick in, and then over a period of time, we're now shrinking the muscles. Did you have headaches prior to that?
Yes.
Did you have migraines prior to that?
Yes.
And how much of a reduction would you say you achieved with your first sitting?
A lot actually, because I used to wake up with them constantly, and just throughout the day I would realize that I would be clenching and I would just have a headache from it.
Yep. And then I know we didn't call and schedule you for the second one, and often I joke with the patients they go, hey, when should I come back? I'll tell them, you'll call us. Because what happens is over a period of time, your body realizes, oh my God, that was really benefiting me.
Yeah.
And that's why we don't even schedule our patients. The manufacturer says about 4 months. I think 4 to 6 months. But thank you so much for your time, Augustina.